Been watching live right now the UN General Assembly, where President Trump is expected to speak here top of the hour to the General Assembly. We will go to that live as soon as we see him. In the meantime, I want to talk about this month, September. It is Sexual Health Awareness Month, and today we are discussing a concerning health trend. It's gonorrhea, one of the oldest known sexually transmitted infections. It's making a dangerous comeback, not only nationally, but here in Charlotte. Joining us right now is Dr. David Siddiqui, an infectious disease expert and chief medical officer at Telemed 2U, joining us now to help us understand what this means for our community. Good morning, doctor. Thanks for joining us here.
Good morning. Thank you so much for having me.
So let's start at the beginning. Explain what gonorrhea is for those who don't know what it's about and why we're seeing this resurgence, particularly here in the South, in the Carolinas.
Well, as you very appropriately stated, Neisseria gonorrhea is one of the oldest sexually transmitted infections that we've been dealing with, and we've had it throughout history. Over the last few years, we've seen a tremendous increase in sexually transmitted infections, or STIs as we refer to them, throughout the United States. Just this year alone, we've seen over 700,000 cases of gonorrhea across the United States, and in North Carolina, we've reported over 7,700 cases.
Wow. And there's also a difference of super gonorrhea versus the traditional gonorrhea. What is the difference?
Absolutely. Well, super gonorrhea is more of a colloquial term. What we're seeing is increasing bacterial resistance. Before, we used to use oral antibacterial. So someone came into the clinic, we diagnosed them with gonorrhea, we could give them an oral antibacterial in order to treat the infection. But unfortunately, the infection has become resistant to those oral medications. So now we're having to use an injectable medication, something called ceftriaxone, in order to treat. No one necessarily wants to get an injection, and it adds to the complexity of treating it. We're seeing more and more resistance across the United States and across the world with regards to gonorrhea, and it's becoming more difficult to treat.
And so if people don't want to get the injection, what are the alternatives?
Unfortunately, we don't have an alternative. We're hopeful that there's some medications that are in research, but they have not been approved by the FDA. Promising research, but we're hopeful in the coming years we'll have some oral medications. But right now, all we have is the injectable, and we're having to give larger doses of the injectable medication in order to overcome that resistance that we're seeing.
So you said we have 7,000 cases reported in North Carolina.
Over 7,000
Over
cases.
seven. I mean, yeah, it seems like it's widespread. Why the rise in cases?
Well, I think unfortunately there still tends to be some type of stigmatism about getting tested and sexual health, and that's incredibly important, right? We go to our doctors, we get our blood pressure checked, we get our blood drawn for cholesterol, but yet we don't talk to our providers with regards to our sexual health, and if we're having any symptoms. We need to have an open dialogue with our providers regarding our sexual health, getting tested, and getting treated when appropriate.
All right. So when you're talking to your provider, your primary doctor, what should you be asking for to advocate for your own health?
Absolutely. I think what you need to advocate is that, as adults saying, I am sexually active, I do have multiple partners, and I'm concerned about my sexual health, and I would like to get tested. Obviously, your provider will ask you if you have any symptoms, and you can convey those symptoms. And definitely, if you're having symptoms, you need to make sure you see a provider immediately. But it's something that we need to do on a regular basis. It's just part of being a healthy adult.
Yeah. Let's talk about the symptoms, doctor. What should people be watching for?
Yes, traditionally, when it comes to sexually transmitted infections, we're concerned about any type of burning or pain when you urinate, any type of rectal pain, or having a sore throat if you engage in oral sex. So, having any type of discomfort should make you concerned that you need to see a provider, especially if you're not using condoms with sexual activity.
All right. Any other ways to protect yourself from, your partner or from your partner or any gonorrhea or sexual STI?
Absolutely. Having open conversations before engaging in sexual activity with your partner, right? Letting them know, where you stand, Obviously, using a condom is the best form of protection, but having an open and honest conversation with your providers and then getting tested and getting checked on a regular basis.
All right. And then if you do find yourself diagnosed with an STI, particularly gonorrhea, which we are seeing is making this resurgence, what is the message out there? And, what can people do to recover?
Well, again, getting tested, getting appropriately treated, and then letting your partners know that, unfortunately, you were possibly exposed to this so they can get tested as well. It's not just about taking care of yourself, it's about taking care of your partners as well so they don't spread it to other individuals as well.
All right. Important discussion to have here this month and every month, really. Doctor, anything else you want our viewers to know?
Well, again, we need to eliminate that stigmatism. If you're sexually active, make sure you're using a condom and make sure that you're having that open, honest conversation with both your partners as well as your providers, right? We need to get tested, we need to get treated.
All right, Dr. Javeed Siddiqui, thank you so much for joining us this morning. Good to know, good information, and a great reminder as you make your way through the world.
Thank you
Appreciate
so
your
much. I
time.
appreciate the opportunity.
Of
Thank you.
course.